Hello and Assalamu alaikum. Welcome to Scan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the placement of implants and an overdenture after the implants have been placed. This is the panoramic view. We're going to show you the maxillary arch first, and then we're going to move on to the mandibular arch. On the maxillary arch, you can see we've got medias and the central incisor on the upper left hand side, and then we've got edentulous spaces on the upper posterior right and left quadrant. Now, the transaxial view is basically the proximal view. This is the central incisor here. Implant placement is definitely possible. After extraction of this media and grafting, we got 6 mm of bone width with approximately 11 millimeters of bone height. Moving to the lateral incisor region or the canine region. So here we got just distal to the canine. We can see we've got some good bone, and here we've got approximately 6 millimeters of width with 11 millimeters of height. So another good area for implant placement. Distal to this, we've got very thin ridge and very resorbed ridge, and unless a sinus lift is done, the posteriors cannot be included, even the premolar region, because this is just the second premolar region, and here we've got approximately, apologies, 6 millimeters of width with 10 millimeters of height. But again, the bone dips here in the middle and becomes 4.7 millimeters in the middle of the ridge. Moving to the upper left hand side, this central incisor is probably grade 2 mobile. We don't have any good bone support. In the lateral incisor region, we've got a thin ridge, knife edge. The canine, we've got a thin knife edge ridge. On the posterior area, where the premolars are, again, we've got very resorbed ridge. So the upper left hand quadrant does not have sufficient bone, so bone augmentation is advised prior to implant placement. On the lower arch now, we're moving at the lower left 5 region. The second premolar, we've got 6 millimeters of width with a good 13 millimeters of height. A implant, straight or angled, can be placed here just distal to the inferior alveolar nerve. Medial to the inferior alveolar nerve, we've got again a slightly thinner ridge, but again 5 millimeters of width with a good 15 millimeters of height. So here an implant can definitely be placed as well. Moving to the canine region, again we've got good bone here. Again, if this tooth is extracted, so we've got 6 millimeters of width with 14 millimeters of height. The central incisor region, again we've got good bone if the tooth is extracted. Again 5 millimeters of width with good 11 plus millimeters of bone height. On the lower right hand quadrant, we've got slightly thinner ridge at an angle. We've got 4.8 millimeters of width with approximately 11 millimeters of height. This is the canine region. This becomes very knife edge. So here an implant placement is going to be difficult. In the first premolar region, you've got good bone. This media can be extracted and grafted, and then an implant can be placed very comfortably, as you've got 8.4 millimeters of width with 15 millimeters of height. Just distal to this, we've got very good bone again, 7 millimeters of width with a 14 millimeters of height. So the lowers can definitely get either 4 or 2 implants placed, and then an implant supported denture. The upper right hand side, you've got some bone, but on the upper left hand side, we've got absolutely no bone. This is the axial view. Axial view is a top to bottom view of the lower jaw. The lower jaw, you can see we've got bone present on either side. On the upper jaw, however, you can see that there is very knife edge thin bone, and then the sinuses start. So again, bone height is not sufficient in this region. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.